you tell us what exactly is pancreatic cancer?
So pancreas cancer is a cancer that occurs in the pancreatic gland, which is a gland deep in your upper. This gland has a number of functions. One of the most important ones is producing insulin that you need to deal with some other enzymes which digest fat, for example. So it's a very important gland. And when it fails, you can get diabetes, for example, and also trouble with digesting this fat.
And Doctor, I believe there are low survival rates and you do have some stats, but there are also similarities to other cancers like ovarian cancer that have minimal symptoms, especially in the early stages.
You're right, and that's the real key to this disease and the reason why people present late and it has such a terrible prognosis. In fact, pancreas cancer is probably going to get to the top of the terrible leaderboard for the biggest cancer killer within the next few years. And yes, you're right, like ovarian cancer, it can be very difficult to know that you have it. Often it doesn't produce any specific symptoms, but very vague things like upper abdominal pain, perhaps weight loss, sometimes nausea, sometimes a change in the quality or quantity of the stools. So it's very, very difficult to detect.
Is there a genetic component, and also what about lifestyle?
Yes, so there are some people with pancreas cancer who have it because of genetic abnormalities, but that represents a very small number of people overall. So perhaps something like 7% of people with pancreatic cancer may have a genetic cause. But the vast majority of people, we actually don't know what causes it. There are some lifestyle factors associated with pancreas cancer, like cigarette smoking, chronic alcoholism leading to chronic pancreatitis. But most people that I meet with pancreas cancer haven't done any of those things. So it's very difficult for us to know how to prevent it in our community.
So, Doctor, tell us about what you have found with this new research called Randoms.
Yeah, so thank you for promoting this study at the Australasian Gastrointestinal Trials Group. We're very proud of the fact that we have involved dietitians and other allied health professionals in our clinical trials. And this trial, the random study, is actually a sub-study of a larger trial that we're doing looking at a new radiotherapy technique in pancreas cancer. But one of our nutritionists, Belinda Steer, who works out of the Peter MacCallum Institute in Melbourne, has designed a study looking at the ways in which we measure nutritional health in people with pancreas cancer, because we think that people who have good muscle bulk, for example, probably do better than those people who don't. And so the next step after this study will be trying to improve that for people with cancer.
So in terms of nutrition, what types of food are you recommending for people with pancreatic cancer?
So we encourage people to have a balanced diet, but to make sure that they have adequate amounts of protein, because as everyone knows, protein feeds that muscle. We really want them to keep that muscle bulk. And we've heard recent evidence, and it's actually been publicised in the last few days in the media, that exercise helps people with cancer. And so if you are able to do some form of exercise and maintain protein intake, then that will serve you well as you go forward having treatment.
And this week, Doctor, we heard Victorian type 1 diabetics are to be the first in the world to try a new type of drug to hopefully prevent the disease from constant insulin injections. You did mention before that there is a similarity. What can you tell us about this?
So there is a little bit of a link between diabetes and pancreas cancer, just because the pancreas gland is the gland that produces insulin. So we are starting to try to get out into the community and to our primary practitioners to let them know that if they encounter patients who have diabetes when they don't have any other usual factors, so for example, if someone develops diabetes and they're losing weight, we would encourage the GP to screen them for pancreas cancer. Also, if you already have diabetes and all of a sudden, for no reason, your blood sugars go out of control, that's another group of people that we would like to see screened.
And finally, Doctor, we often hear that we all have cancer cells. Can you clarify that statement for us?
Yeah, so that's an interesting statement, and there probably is some evidence to suggest that over time in our bodies, some of our cells mutate, and they mutate constantly. Let's take the bowel, for example. We think that bowel cells that line the bowel mutate very often, but our body is usually able to detect those faulty cells and to get rid of them with your immune system. Over time, as we age, perhaps we develop more of these mutations and our body is not as efficient at dealing with them. So that's probably why cancer, generally speaking, increases incidence with age.
Well, very in-depth information, and really thank you for coming on the show today, and we wish you and your team all the very best for the research and look forward to hearing all about it. Thank you, Lorraine Chantrill.
Thank you. Thank you so much for helping us out. Really appreciate it.